Okay guys, here's my last one. This is the Maxpedition Jumbo, or excuse me, Fatty. I think it's called Fatty. This is, as you can tell, this is my med pouch. So I wrapped some red paracord on the pull handle, swapped out the paracord, zipper pulls for red ones just so it's idiot proof. If someone has to get into my pack for some med gear, they know where to find it. So, it actually took me a long time to figure out how I was going to fit everything I wanted in here, because I had to take some stuff out, swap some stuff, so, I think I'm going to try and get the FR1, but it's taking up a lot of space in my EDC. I mean, I take this much med gear with me everywhere. Plus I have med gear in my car, so I don't know what I'm going to do, but this is just what I have for now. So, right here, just have some hand sanitizer. This is sun spray and insect spray, which is a red Sharpie. Well, I don't know if a lot of people know why people keep Sharpies in med packs, but what I do is, if there's a large catastrophe or something is going on, a lot of people will use something to write on somebody, either their vitals when they were checked at this time, what they were, you know, whether or not this patient's going to survive or not, you know, what kind of care to give them. So if you're in the field and you're looking at a patient and you check their blood pressure and it was through the roof, you check their blood pressure, you write it on there and you say, you know, what time you checked them and your initials. So that's just what that's for. Some afterbite, you get bit by bug bite. I think it works for like, oh, what do you call it? Poison ivy, but I'm not positive. But it's really good to have, especially in the summer months. Nail clippers. These are some Rolaids and some Abreva in a little pack. My fiance gets cold sores, and it's best if you just put it on right away, so that's what that's for. This is a two-person SOL bivy sack type deal. Can be used for a tarp if need be, but really good for shock. Someone's got hypothermia or what the case may be. Some Germ-X soft wipes. Some Quick Clot. What else I got in here? And just a couple of antiseptic wipes. On the other side I have a headlamp. If you're working on somebody in the dark, you want to be able to see them. It's got 3 modes. And that's what the 3 AAA batteries in one of my other videos are for. This takes 3 AAAs, and then my other flashlight takes 2 AAs. I have a very small thing of Vaseline. This can be used for many different purposes. This is specifically for lip therapy, is what it says on there. But I mean, you could make a fire if you needed to warm somebody up. They have hypothermia or something. There's a million different. You can put this on some gauze to make sure it doesn't stick to a wound. Million things you can do with Vaseline. This is some Neosporin to go. This is the spray stuff. I love Neosporin and antiseptic, but I find that, you know, if you're touching the tip of your dirty finger to the tip of the Neosporin, then it's no longer, you know, then it's probably dirty, or you're touching it to a wound, and this is a spray, so it doesn't have to get right up to the wound. You just spray it on there, so it works really nice. In here I have a bunch of Band-Aids, butterfly bandages, different sizes. I just stuff this thing full. It's just a nice way to keep everything organized. And then I just have it wrapped with a hair tie just to keep it all closed, because it kept popping open on me. If I can get it back. Just have little 1/2-inch medical tape with a couple of earplugs. I have a small set of tweezers. Actually came in a med pack that I bought. So those are super nice. They're really pointy kind. And this little tube to keep everybody safe. This is a tourniquet. Small one, but better than nothing. This is New Skin. It's a liquid bandage, so if you have a cut, you just put it on here. As far as keeping everything sanitary, you can either let it drip off the brush that's in here, or you can put it onto a tissue or something else to make sure that you don't get the brush in here dirty, because then it's just useless. You need to throw it away. I love this new Nivea lip butter. It's awesome. So I have like one of these everywhere. I have a couple of these. I'll probably do another video on my pencil pouch that I take with me every day to school, because some of the items that would be in my EDC kit are in my pencil pouch kit. But in here I have some allergy meds, some aspirin, some Aleve, and some of my prescription meds. Then in case I forget to take them, somebody needs something, I have it. This little zipper compartment in the back. I have some meds that I don't need near as much in these easy dose pill pouch things. So I have some anti-diarrheal, some Dayquil, and some NyQuil, just in case. Just gonna try and take all this out here. So a couple more sanding wipes, a couple knuckle bandages, some 2-inch gauze, a couple blister treatment cushions from Dr. Scholl's, thing of moleskin, another antiseptic wipes, a couple 3x4s, some gloves, a mask, and then some emergency. So that's pretty much all I could fit in my kit. I do have some other stuff in mind, but if you guys have some options, or maybe I have too much of this, not enough of this, let me know. Obviously this isn't something that I have a triage bandage or anything, but I do have some quick clot, I do have some gauze. Other than that, it's basically a boo-boo kit. You know, if you have an upset stomach or what have you. I'll do, or you know, if you have a blister, I have something for that. If you have a splinter, you know, stuff like that, nothing major. A lot of this has to do with your knowledge. So if you know how to take care of somebody who has a broken arm in the woods, there's nothing, I mean, besides a huge one of those splint things. I'd rather use a stick and maybe a tourniquet, some paracord, maybe make a splint. Better than carrying a splint around. It takes up a lot of room, and how often is that going to happen? One of my professors broke their wrist last fall. She splinted it with a notebook and walked into the hospital. I mean, you're not going to be able to carry something that, if you break your leg, you're not going to carry a leg-long splint, okay? So this is stuff that, you know, I have knowledge on how to do some of that stuff with stuff that isn't necessarily here, but stuff that's going to be around. A big stick if you're in the woods, a binder, a notebook, whatever you have around. You learn with what you have around. This would just be something that would kind of help me. So again, with, you know, throw Vaseline on one of these gauzes, wrap it up with, you have some tape, okay? You need to stop a bleeder. You have a tourniquet here. There's lots of stuff you could do with what you have here. It's obviously not an end-all be-all kit, but it's a start. So just keep that in mind when you're leaving comments. And let me know if you think I could trade something out for something better or what have you. I appreciate all your comments, and thanks for watching.